You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you for joining me today on Simple Health Radio. I'm your host, Dr. Emron. On today's episode, I will discuss the case of an elderly man I saw about 1 month ago. He was 83 years old, and we'll call him Gilbert. Gilbert had a history of Alzheimer's dementia. He was living at home with his wife. He had some episodes of forgetfulness, and overall he was doing well. However, his wife brought him in because he had fallen the day before. He had a history of frequent falls, but usually it was related to an infection, such as a bladder infection or bronchitis. But on this particular episode, he just fell while walking. He struck his head and he had a mild bruise on the face, and that was really the reason that the family brought him in the day after the injury. He had no nausea or vomiting. Since I had not seen Gilbert before, I advised that we should do a full workup, given that he may fall again if we are not careful. The family agreed. We did a urine sample, which was completely normal. He had no evidence of a bladder infection and no signs of any bleeding in the urine. We did a CAT scan of the brain to make sure there was no stroke or blood clot, and that came back normal. We did a complete blood count to see what the white count, hemoglobin, and platelets were, and those were all normal. And then we did a comprehensive metabolic panel, which is a blood test that looks at the blood sugar, vitamin levels, and the liver function. Everything came back normal except for one value, and that was the sodium. So his sodium level was very, very low. It was 120. So he was in the category of hyponatremia, which was causing his falls and dizziness. And that's what we're going to talk about today. Hyponatremia is actually a very common condition. First, we'll have to define what sodium actually is, and then we can explain why hyponatremia can be so bad. Sodium is a type of vitamin. Normally, we get it from the foods that we eat. It's related to other vitamins in the body as well, including potassium, calcium, and it has a role to play in the nerves and how they function, as well as the cells in how they exchange information and other nutrients. The sodium can be measured in the blood because it's outside of the cells. Potassium is also measured in the blood, but most of it's actually inside of the cell. What that means is that the sodium level in the blood sample will always be much higher. For example, a value of 130 or 135 is going to be considered normal. Potassium is the opposite. Potassium is going to be very low in the blood, so it should be a value of 3.5 up to 5.0. So those are very big differences in terms of how we measure them, but any changes in either of those numbers will cause people to feel very, very bad. Now, in this situation, the patient had hyponatremia. Natremia is the basically Greek word for sodium in the blood. Hypo means low. In this situation, because the patient had dementia, we couldn't quite get the full story as to what was happening, but there were a couple of theories. One is that the patient wasn't eating on time, and if he wasn't consuming the full meals. The second is that he may have been drinking more water than he required. For example, if we eat potato chips or we have pizza or cheeseburger that has sodium in it, which is a natural component of those foods, naturally we'll drink more water because that helps us quench our thirst. Now, in some people, for example, the elderly or people with dementia or people who take other medications, they may or may not have the same response. So when they eat food, they may feel thirsty, but they may drink more than they require, or they may drink water over and over and over again because they forgot that they just drank it. And in those cases, those people actually overdose on water, and that dilutes the blood, which in turn causes the sodium level to drop rapidly. Now, as we mentioned, sodium is necessary for the brain, nerves, and other organs in the body to function properly. So our suspicion is that over the past several days, the patient either had not been eating enough or had actually been drinking far too much water, and that's why the sodium level was so low. We did some additional testing to confirm. We did an EKG, his heart rhythm was normal, and on the physical exam, he was otherwise looking very good, but I was concerned that if we sent him home, he may relapse or be unable to meet his normal requirements. At that point, we made a decision with the family to admit the patient to the hospital. The nephrologist, which is the kidney specialist, was consulted. He examined the patient and did some additional testing, and fortunately there were no other abnormalities. The treatment that I initiated in the emergency department was IV fluids. Now, IV fluids are also called normal saline. Saline is another word for salt. In a 1 liter bag, which is a standard size, the concentration will be 0.9%. That value is based on the balance that should normally be in healthy people. So we give 0.9% normal saline. Now, in this case, his sodium level was low. There are some situations where we have to give hypertonic, meaning very, very concentrated IV fluids to those patients to bring the sodium level up faster. But I didn't want to do that because I was hopeful that just the normal saline would be enough to bring him back to a normal level. Now, the patient was admitted to the hospital, and 8 hours later, the lab rechecked his sodium level, and it was improving. So he went from 120 up to 130, and his value was back to normal again. The patient was feeling quite well. He had no signs of any dizziness, and he was discharged home the following day. So he was actually very fortunate that we corrected the sodium so quickly and were able to prevent permanent damage or any complications. There are many people, however, who have hyponatremia and they don't receive treatment in a prompt manner. Those people can actually suffer from brain damage because the brain can actually have swelling that goes down into the brain stem, resulting in what looks like a stroke. And those people may end up in a coma or worse. And so that's why it's very critical that anyone who has an impaired sodium level has to have a full workup to identify the cause. There could be medications that are causing it, including certain antidepressants or antipsychotic medication. They have to look for infection, and they have to make sure that the kidneys are able to produce urine to excrete that water. In this situation, all of those things were verified. He did very well, and he was sent home. But it is possible that he may develop the hyponatremia again in the future. And so normally we advise the family, keep a very close watch. What are they eating? What are they drinking? Make sure that the patient is going to the restroom. And that would be the best way to prevent this from happening in the future. So I hope you learned a little bit about hyponatremia and low sodium in the blood, and that you can recognize some of these lab values in the future. If you or your family have any concerns about this, or if you find out that you yourself have an issue with a low sodium, always follow up with your doctor or go to the nearest emergency room so they can recheck your lab work, offer you treatment, and hopefully identify the cause and keep you healthy. Thank you so much for joining me on this episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.